With grim pictures playing out in hospitals in New York and other parts of the country, the president's Easter aspiration seemed implausible when he first suggested it.
The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines. Therefore, we will be extending our guidelines to April 30th to slow the spread.
The change of heart from the president comes after he received a briefing from the coronavirus task force that presented him with the grim prospect that up to 200,000 people could die, even with mitigating measures like self-isolation and social distancing in place. The president then appeared to suggest that June 1st and no longer April 15th was a plausible date for the United States to get back to normal. But as his top infectious diseases advisor has indicated time and again, it is the virus that creates the timeline, not the other way around.
Berg said, this is exactly what you
With science and data, for now, winning the day.
We feel that the mitigation that we're doing right now is having an effect. It's very difficult to quantitate it because you have two dynamic things going on at the same time. You have the virus going up and you have the mitigation trying to push it down. But the decision to but to extend this mitigation process until the end of April, I think was a wise and prudent decision. Dr. Birx and I spent a considerable amount of time going over all the data, why we felt this was a best choice of us, and the president accepted it.
Spikes are also being seen in New Orleans, Chicago and Detroit, but it's New York State that passed the threshold of 1,000 deaths on Sunday, with almost 60,000 cases in the region alone.
Natural disasters are an inevitability, but the idea that you would be facing this thing that has shredded, not a city and not a country, but the world, it's not something that my mind had ever really considered. And part of the stress that I think is mine and is shared by a lot of my friends who work all over the place is that this is a little weird. It's not something any of us have prepared to do. And we're kind of writing the book as we go. There's no textbook on how to deal with a global pandemic.
First responders and frontline health workers lauded for their selfless sacrifice as hospitals already stretched brace for an apex of cases in April.
Everyone is afraid. Everyone is afraid. You think these police officers are not afraid to leave their house? You think these nurses are not afraid to go into the hospital? They're afraid. But something is more important than their fear, which is their passion, their commitment for public service and helping others. That's all it is. It's just their passion and belief in helping others. And that overcomes their fear. And that makes them, in my book, just truly amazing, outstanding human beings.
This 1,000-bed Navy ship expected to dock in New York City Monday and will treat non-coronavirus patients to ease the current COVID-19 hospital load. Sherwin Bryce-Pease, SABC News, New York.
And now we go to our correspondent, Sherwin Bryce-Pease, who is in New York, speaking to him via Skype. Sherwin, some have said this is an amazing turnaround for Donald Trump, given the fact that he almost downplayed the seriousness of this disease and its effect.
They've used the word jiu-jitsu, Tepiso. This is a complete turnaround from the president. But I think anyone with a modicule of intelligence would have known that even when the president made the, this aspirational date of April 15th, Easter, he wanted to see churches packed on Easter Sunday. Anyone with a little bit of intelligence would have known that that was not possible, given what you were seeing on the ground, what you were seeing in New York, what you were seeing in New Jersey, in California, and Washington State. The spiral was going up, not down. The curve was going up, not flat. And so, this was a president concerned with the economic impact in an election year, but finally coming to terms with the advice from his experts. And what really did it is what Dr. Fauci said yesterday at that press conference in the Rose Garden at the White House, was presenting the president, Tsepiso, with a model that showed that anything between 100,000 and 200,000 deaths would be incurred in the United States, even with the social distancing and self-isolation measures that are in place. In fact, the coordinator of the White House task force, Dr. Deborah Birx, was on one of the cable news shows here this morning, and she said that the death rate between 100,000 and 200,000 in the United States is a best case scenario. So let that sink in for a minute. The president also referred to models projecting that some 2.2 million people would have died had the United States not taken the measures it has now implemented across states in this country. And even suggesting, very sort of surprisingly to many of us watching, that would be, if the number was in fact about 100,000, that would be a good representation of the effective measures that his administration had put in place. So the president seemingly would be satisfied with 100,000 dead, if not the 2.2 million that one of those projections showed him.
I believe also another thing that could have rattled him, Sherwin, is scenes from Elmhurst Hospital in Queens, where he grew up, where he said he's been watching it for the past weeks and all he could see was body bags coming out of that. How true is that? That could have been the one thing that pushed him to take this decision of an extension.
Very much so, Tsepiso. Well pointed out there. The president had actually taken some time to talk through having seen these pictures at a hospital in Queens, New York, where he grew up as a child, and seeing body bags, leaving the hospitals into refrigerated trucks parked outside. Why the need for refrigerated trucks, for example? Because the death toll is so high in this part of the country. I'll just give you some numbers. Some 253 people have died since yesterday, according to Governor Cuomo, who does a daily press conference here and gives us sort of the latest figures. And of course, that number was 500 on Saturday. So you're seeing the death toll go up. You're seeing the number of infections go up in terms of cases based on the increased testing that we are seeing in New York, but also accounting, therefore, for almost half of the death rate that we're seeing in the United States, Tsepiso.
So quick and final one, Sherwin, what does this mean for you and everybody else in the United States, this extension of 1 month? Is there going to be a change in the procedure that's already in place?
No, essentially it's, maintain the current procedures. What we have is a little different to what you have in South Africa. We don't have a lockdown. We have a stay-at-home order. Essentially, 100% of businesses are required to have their staff work from home. They're not allowed to come into companies or premises, except if they are working in essential industries like, security, police, first responders, and that sort of thing. So we are just continuing with staying at home and working from home, Tsepiso, but we are allowed to go out for, solo exercise. But what I've seen on those solo runs of mine is that people are not adhering to the prescriptions from the government. You see people on a lovely day, if the sun comes out, we're heading into spring here, people are sitting in groups, having picnics or running together or talking together, and that is not what the prescriptions are. If you go out, you have to do so below, get your business done, and get home as soon as possible. So we'll continue to do that, but no one knows, right? They say April 30th, he wanted April 15th. We don't know when this thing ends. We have to base this on the data and the science, and when that curve begins to flatten, Tsepiso, is when we'll get a clearer idea of when we can leave our homes a little bit more regularly.
Thanks a lot for that, Sherwin Bryce-Pease, SABC correspondent, speaking to us in New York. And I just want to get those latest figures for you just in terms of what is happening in the USA. But I think this should be a very sharp warning to South Africans. President saying that we've got another couple of more days to go. But you see there in the United States a warning that there could be even more than 100,000 deaths. President Donald Trump finally waking up to that reality after his previous statement saying that he sees it important now to extend their stay-at-home period by a month, and they are within the third week of their stay-at-home phase. So South Africans do take heed. The US has at this point 152,631 confirmed cases, 2,817 dead. The number of people who have died today, 234. Number of people who have died in total, as I mentioned, 2,817, and yet the projections are 100,000 people could die if people don't adhere to those rules.